Hello, I'm here again with Dr. Balazs Zsentis. Today we're going to talk about some questions revolving around data visualization and how it matters in clinical operations. So, what are some of the external forces that are impacting healthcare and causing an increased awareness or focus on data and data visualization?
Well, the American healthcare system is very expensive. I think it's well known, and in some measures it doesn't live up to the standards of other developed nations. Around the turn of the century, there was a very famous report describing the number of medical errors and how many people died due to errors in this system. And that led to regulations and the goal, a strategic goal of the AAM, that included the good experience for the patient, improved health of the community, and efficient delivery of healthcare that is affordable. These became strategic mandates for healthcare organizations and the entire healthcare system. And to deliver these required more sophisticated data structure than we had before. As the AAM was implemented and the electronic medical records started to become more ubiquitous, more goals like clinician satisfaction, sustainability were added to the core drivers of a healthcare system. And this created a fairly complex matrix of needs and drivers that required more sophisticated analytical and management tools that we had before. The goal remained patient care and healthcare and medical science, but many other aspects and elements became vitally important to manage, and that requires data and data visualization. The other main driver, I think, computer science evolved, and the amount of data that we can manage and the computing and processing power improved significantly, and that opened up opportunities for big data, genomics, and so on. So there are multiple new drivers that are external to the traditionally described healthcare that are important to manage and are crucially important in our lives.
So what are some examples of how that's leveraged internally at Rochester Regional, and then how does it impact at a provider, departmental and or a system level?
Well, I think we talked about data visualization. I think very simple examples are in-the-moment data display beyond abnormal lab results and safety levels of medications. We actually display cost of tests and cost of medications that we prescribe. So we are aware of elements of the AAM even as we practice. Obviously, there's a much more sophisticated data background behind it with dashboards that can be shared with healthcare systems, hospitals, departments, units, individual providers about their performance around patient satisfaction, about their clinical outcomes, the utilization patterns compared to benchmarks and their colleagues. And as I mentioned, with the addition of clinician satisfaction, we used the quadruple aim in addition to the three previously mentioned goals. Clinician satisfaction and efficiency are critically important, and we use metrics for that. We use our EMR to see how our clinicians utilize the electronic medical record, how much time they spend in there, how satisfied they are with it. And we develop our EMR based on that feedback and that information, and also target our training based on that. And again, in order to get the necessary investment and engagement for these efforts, we rely on data.
So Balazs, what are some external examples of ways you've seen healthcare data leveraged?
One way to explain that question is how we display external data that is external to our health system in our electronic medical record. And we certainly do that in many ways. It's a very complex question, including data standardization, health information exchange. I think it's important to deliver the data similarly how our internal data is displayed to make our clinicians' cognitive patterns easier, but I don't want to get much into detail. Rather, go to another way to answer your question is how we use external organizations' examples in displaying and visualizing data, how we learn from them. And that includes many options, including heat maps and geolocation metrics and so on. So we learn from organizations in healthcare and outside of healthcare about how to visualize data, both for clinical and management purposes. But the third way, and I believe the most exciting way to answer your question, is how to display data that is external to traditional healthcare. We need to move from a healthcare system to a health system. We need to make sure that we keep our community and our members healthy. And that requires collaborating with providers and entities that are not in the healthcare system to address issues like food security, transportation needs, social stressors, etc. And for that, we need to create a network to address these social determinants of health that is, again, traditionally external to our domain of expertise and practice, but it's critically important to visualize the data to drive this engagement.
So I think you've already started touching on this, and that's really interesting, but how do you envision providers leveraging this information?
Yeah, so we already leverage this information in primary care and upon discharge planning. We want to make sure when people leave the hospital, they have the necessary social support system and transportation and so on. But we need to do much more. We need to be more proactive. We need to get, again, more data from population health to analyze trends, not just address individual people's needs, to make sure that we invest in community resources where necessary. And again, we need to develop this network, and we need to exchange information with these entities, regardless of people's insurance status, regardless of which health system they belong to, or which specific transportation service they use. It's really need to be built around the patient and around the community, which requires a new way of thinking, which we work both in our system and in our community with help of multiple organizations and societies.
We've talked about a lot of the pros. Can you talk about some of the cons associated? Are there risks on how we present this information or how it's interpreted externally?
Yeah, I think the number one risk is probably privacy. I mean, obviously, there are evolving cybersecurity risks, and as we exchange more and more information that is very relevant and very private for our patients, we need to make sure that that data doesn't get into the wrong hands. At the same time, we need to make sure it gets into the right hands, and that's a challenging task in today's environment. Now, I don't want to downplay the need of getting this data benchmarked and analyzed in a proper way. It's a new type of data, so it's going to be challenging to really respond to it. We have hundreds of years of experience of how to interpret a lab result, but this is something new, and we need to come to a shared understanding what this data means and how to address that. But although there are risks and challenges, I think it's crucially important that we move beyond just treating diseases or even addressing individual people's healthcare needs. We really need to focus on the health of the patient and the well-being of our patients and clients and our communities. And really, the only way to do that is this collaborative data sharing that we just described.
That's really interesting. Thanks again for your time.
Thank you.